Hello, doctor.
Hey, how are you?
I'm good. How are you?
Good, good, good,
We
good. Thank you
finally
very
did
much.
this as happens with doctors. I'm in surgery and I have to be late, or I'm in surgery. It's like, really, what's more important, that surgery or my podcast, you know?
Yeah, yeah, right, right. It's a good excuse, right?
It's a great excuse. Sure, you had a surgery. I'm so happy to have you here because we're not only going to talk about male factor infertility, but I've really never dived into that. And I want to, but let's talk about how you ended up in the world of urology. And I think you come from a line of urologists, if I'm not mistaken. So tell me, was this something you always wanted to do? And how did you end up doing it?
Yeah, so I do come from well, my father's a urologist as well. But I actually thought I was going to go into orthopedic surgery when I was in residence, when I was in medical school. Then towards the end of medical school, I had a chance to check out urology only because my father did it, and it really is. It's one of the best fields in medicine, especially if you want to do surgery. Um, it's good work-life balance. We're not doing life and death, which really for my personality it matched it. And then
Mm,
once I got into urology residency, I had to decide what to do next. And the reason I got into men's health and male infertility really is because at the time there was very few people who were doing it. I was living in LA at the time. Even in a major city like Los Angeles, there's only you could count the number of people who were doing it on one hand. So I thought it was a unique opportunity. And more importantly, we're dealing with, helping young guys with the challenges of um, overcoming infertility issues was something that really appealed to me.
mm. I love that. Was the surgery enticing? Because I find that's the one common thread with most doctors I have on. Surgery is like what gets them excited to become a doctor.
Yeah, I mean it's the idea of the personality type that there's a problem and you could fix it and you could fix it with your hands,
Mm,
right? So you could fix it now and to see it go from is to see you solving the problem right from the beginning. At least for me, that's the reason why surgery has always been enticing. But even as a young kid, I was always using different projects, building planes, different building different contraptions. I always liked using my hands, having my hands do what my brain wanted to. That's always been something that I like.
okay. I love that thinking about it that way.
Yeah.
So, how does one build a urology practice? Because yours is, as you said, there are very few of you around, and yours is one of the biggest, if not the biggest one in LA. Every male infertility person I know has been referred to you. They love working with you. How did you go about building that practice when you were starting out?
Yeah, it's a lot of work. Obviously, it takes there's no real easy way of doing it, but it's really just going out there and introducing yourself to people, referring doctors. One of the things that's been wonderful is social media. I think previous generations of physicians, they really, in order to tap the masses, was very difficult. But social media, the internet, spreading the word, and I think one of the unique things was, at least when I started my practice, young guys have always been or had started to get really proactive about not just their overall health, but their fertility issues, their hormone issues, sexual function, all of those things, which is what my practice is. And because they're more proactive about it, the taboos, the stigmas associated with addressing male infertility issues was dying down, and it continues to. It becomes more of a topic that men like to discuss. So I got lucky in that sense because, and the way I really did it was on social media. I promoted talking about these topics, and I got very lucky that it really caught wind with a lot of young men.
Yeah, right place, right time.
Right place, right time.
So let's dive into the fertility piece of it. Um, Male factor infertility, I think, is often incredibly early diagnosis or incredibly late diagnosis, is what I find. Like people either know going in, at least many people I work with, they know going in that sperm is one of the factors. And so they're proactive about it. They do what they need to do. Or they don't test, they assume it's the woman's issue. They don't do the initial testing on the male partner soon enough. And like it's one quick fix once they come to the urology department. How are you seeing those patterns change? Do you agree? Like what I want to also go into like what do you see as the most common form of male factor infertility, and are there ways to troubleshoot that in the future? Sorry, that's a lot at
Yes,
once. So answer in
yeah.
whatever chunk you want.
Well, here, so I'll say, so when it comes to male factor infertility, there's four things that cause that really are the culprits. Number one, lifestyle. So essentially when you're unhealthy, drinking, smoking, illicit drugs, not exercising, poor diet, not getting enough sleep, stress, all of those things. That's the easy one to fix, or that's probably the most common one and it's easiest one to fix in terms of just telling patients, hey, listen, you got to clean it up. Try not to smoke as much, try not to drink as much. Actually, smoking, really stop it, and then drinking, really minimize what you can. Second thing is abnormal hormone levels. So we know that you have to have good testosterone levels, natural testosterone levels, not synthetic testosterone, but a lot of guys, especially these days, low testosterone. I think we've heard about this. Low testosterone is becoming more and more prevalent. So when guys have low testosterone levels, that really negatively impacts their fertility. The third thing is genetics, and this is the one that the hardest one to fix because everyone's dealt a hand, and at some point, you have to play the hand that you're dealt. And some people that really help, they're dealt the hand where they're unable to produce any sperm or very, very low quantities and low counts of sperm. Um, that's the third bucket, and the fourth one is if they have anatomical issues, which is a varicocele, and that's quite common as well. So to answer your question,
Can you break down what a varicocele is? A lot of people come to me with that question.
yeah, so a varicocele is essentially we all know varicose veins of the legs. A varicocele is varicose veins of the testicles. And the reason why that's a problem is because the testicles like to live in a very narrow temperature range. And that's the whole point of the scrotum. The scrotum relaxes and contracts. It's kind of the thermostat for the testicles to make sure they stay in that range in order for them to properly produce testosterone levels and sperm. What happens with the varicocele is because your blood pooling around the testicle, the temperature raises. And as a result of that, either your sperm counts go down or the quality of the sperm. You're producing good sperm counts, but the quality of the sperm declines. And the only way to fix that is surgically. The way we do it, or the way I do it, is a microsurgical varicocelectomy. It's microsurgery, using a small incision. That's probably the best way of fixing it. But yeah, that's that fourth bucket in terms of anatomical issues that could potentially cause infertility.
So, and for the varicocele, when you do that surgery, you are taking out something or connecting something.
Great question. No, so what it is really what we do is we isolate the spermatic cord. The spermatic cord is what the testicle hangs from, and within that spermatic cord, there's the vas deferens, which we're all familiar with. That's what we do the vasectomy on. We cut that to prevent the sperm from going out into the ejaculate. There's an artery that provides blood flow to the testicle, and then there's basically a group of veins that drain blood away from the testicles. So what happens is we tie off those veins. So therefore, by tying off those veins, the varicocele, the blood above it is no longer pooling around the testicle. The body finds another way of getting that blood back to the heart without causing engorgement of those veins. So by stopping that backflow of blood, by just tying off, not removing, we're just tying off those veins, we're preserving testicular function. And hopefully the goal really is to preserve fertility or improve fertility.
Wow. So if somebody has a varicocele, what do you call it? A varicosectomy?
Varicocelectomy.
Selectomy.
Yeah, varicocelectomy.
Varicocelectomy. How long after that do you think you would be able to produce quality sperm for impregnating somebody?
Yeah, so something to know is sperm from the time of it being made to the time of it being ready to ejaculate and to hopefully fertilize an egg is about 72 days. So we say anywhere from 2.5 to 3 months. So generally, I try to tell guys 4 months after your varicocelectomy, you should start to see improvements in your sperm counts.
And we'll go back to reasons one, two, and three. But in that case, is there pain after that surgery? Do you need to heal also in that 3 or 4 months? Or could you theoretically be sexually active right away?
Actually, because it's an outpatient surgery, we do it because it's microsurgical, we do it through a very small incision. And the smaller the incision, the less the post-operative pain. So patients really they're able to engage in essentially their normal life within a few days after surgery. I tell guys try not to exercise for at least a week, but after that you're good to go. And then
Wow.
intercourse realistically within a week, sometimes even less than that after surgery. Yeah, it's a relatively straightforward procedure, and luckily the outcomes on it, especially from a fertility standpoint, are fantastic.
And how does one test for a varicocele?
Yeah, the main way is a physical exam. So a patient will come in with infertility, whether it's low sperm counts, poor sperm quality. We'll do a physical exam on them, and a lot of the times you could just feel it, right? As a doctor, you could just feel it. If there's a little bit of doubt, what we do is we get a scrotal ultrasound and we measure the diameter of that vein, and we have some objective numbers to say if it's this diameter, then this is considered a varicocele. If it's under that size, it's not considered a varicocele.
Okay, let's get back to
Yeah.
reasons one, two, and three. So we have lifestyle. And like you mentioned, sperm can regenerate in 72 days. So if you're eating crappy food, does it really make a difference in those 72 days to clean up your diet?
You mean from well,
From the time, so let's say you see somebody and you're like, your sperm quality's shit. Let's get you on a healthy plan. Let's start with your diet. Do you think would you see a difference in a semen
yes,
sample 72 days later? You would.
yes.
Faster, better
Smoking.
morphology. Like, what do you see that's better?
Well, it depends on what let's say they come in, they have normal sperm counts, but the motility and the morphology are off. And then let's say all the other factors that we talked about are okay. Their hormones look good, sleep, that's fine, stress levels are okay, but they're eating like crap. I tell you, if they improve their diet with not exactly 72 days, but within 3 to 4 months, we should see an improvement in terms of whether it's their sperm counts, whether it's the quality, what have you. We should start to see some improvement. Is it going to be a massive improvement to the point where they're unable to impregnate anybody, and then now they're able to, on the first shot, they're able to
Yeah.
impregnate? Probably not. But all we're trying to do, we're just trying to move the needle a little bit, and
Yeah.
by doing that, really, because look, guys are ejaculating tens of millions of sperm each time. Only one of those sperm have to make it to the egg. Only
Right.
one. So, but even these small incremental changes make a massive difference in terms of reproductive success.
And we should break down, even though most people probably know, what is motility and morphology.
Yeah, so motility, the way we look at it is, there's a couple things for the semen analysis. We look at the volume, the amount that comes out, the sperm, the concentration, which is the amount of sperm per milliliter, like the number of sperm per milliliter, then the motility and the morphology. So motility is how they're moving. We assess how many of them are moving in the right direction. So sometimes sperm will swim in circles. Obviously, that's not going to get anywhere when it's in the vaginal vault. It's not gonna get to the egg. So the ones that are swimming in the right direction, we try to have at least 40% of them swimming in the right direction. And then the morphology, believe it or not, majority of sperm are actually abnormal looking. So you actually have to have the normal amount of sperm that's like a healthy morphology is only 4% of your sperm. If 4% of your sperm have normal morphology, that's considered normal.
Wow. Wow.
Yeah. Yeah. A
I
lot
feel
of our
like,
sperm are just ugly.
yeah,
Yeah.
like a two-headed, my friends have called it like a two-headed monster before, you know?
Yeah. Yeah. Yeah.
And I feel like for some men, that's a hard pill to swallow anything, like egotistically, they're like, but my sperm's perfect, you know?
Exactly
Um,
right.
okay, so that's reason one. Reason two, oh, one other question. Do you think supplementation helps? And if so, what supplements do you generally recommend to improve sperm quality?
Yeah, so we know that historically we say coenzyme Q, vitamin E. There's certain we have good data on certain things, and now there's some newer companies out there that are reducing the oxidative stress on by taking these fertility supplements, and that could preserve something that we can't necessarily gauge on a semen analysis, but it's the DNA fragmentation. The DNA of the sperm itself has to be good quality. So there's a couple companies that are doing that. One of them is We Natal, and then the other one is Bird and Bee.
Both of whom have been guests on this podcast, and we highly
Oh,
recommend their
nice.
products. Yes, love
Yeah.
them.
Yeah, they have good data supporting their
Right.
product.
Awesome. Okay. And so you would theoretically recommend those to your patients.
Yeah, yeah,
Yeah.
exactly right.
And
Absolutely. It could only
like
help.
from the female perspective, if the male partner can get involved in any way, even if it's just a supplement, it makes us feel like we're so much more in it together, you know?
Exactly right.
Okay, I forget now what number two was. Number three was genetics. Number two was
Hormones.
hormones. Let's talk about those hormones.
Yeah, so we do know that in order for sperm to grow and mature, you need healthy intratesticular
Yes.
testosterone levels. So one of the things I can't tell you how many times in a given week a guy will come to me, he's late 20s, early 30s, and looks healthy, and he has zero sperm. And we start talking to him. He's like, Are you on testosterone?" He's like, "Yeah, I've been on testosterone for a couple of years." Like, well, look, when you take testosterone, whether it's a cream, injection, your testicles like, all right, well, it seems like we have enough testosterone, so we're going to shut down sperm production and testosterone production. So these guys, a lot of these clinics, they don't tell guys that you're not supposed to, or at least testosterone replacement therapy will shut down your fertility. 99.9% of the time, it's temporary. You have to come off the testosterone replacement therapy, and then your testicles will, you'll restart, and you'll start to produce normal testosterone levels and normal sperm counts. But it takes anywhere from 4 to 6 months for those counts to normalize.
what is a reason one person would go on testosterone supplementation to begin with, other than maybe like muscle, like working out? Are there other reasons?
Yeah, so testosterone, we know that as a young man, especially these days, because of a number of factors, sedentary lifestyle, not really spending time outdoors, lack of vitamin D. There's a number of things that are causing this, but we're seeing younger men having lower testosterone levels. Because you really have to be out there. You have to use in order to produce testosterone levels, you have to exercise, sleep right, eat right, all those
Right.
different things that are good for your heart. And a lot of young men just aren't doing that. So when guys feel like their energy levels are low, libido is low, sexual function's not what it used to be, testosterone is usually the culprit. But again, a lot of these clinics, they'll have these guys come in, young guys, without telling them, give them testosterone replacement therapy, and it feels damn good, right? All these guys love the feeling of it, but they don't know about the fertility consequences.
Mm, mm. Do you think that's something, I guess, in terms of couples who come to you, do you find that they come to you in the perfect time, too late, too soon? What do you, in terms of the fertility piece of it, do you have a general sense of that?
Yeah, that's a wonderful question, actually, because it's funny. I was talking to one of my colleagues about this probably at the end of last year. I really feel like the one of the things that we want to do, at least from spreading the word about this, is the earlier you get evaluated, the better. Although 3 to 4 months you make a change and then 3 to 4 months later you notice the improvement, although that's not, significant, in the story of life, it can delay your fertility goals. And that can create a lot of frustration in relationships where, you're pointing the finger, it's your sperm, no, it's your eggs, but it creates that frustration in the relationship. And I've seen it with some of my patients where that frustration could start to, not that it creates long-term a separation or problems, but it create at least it makes the fertility journey a little bit more frustrating, and I could see it creating some problems, at least short term.
Yeah.
But anyways, the point I'm trying to make is the earlier you get evaluated, especially from a male standpoint, it's so easy. Just do a semen analysis. And nowadays, there's a lot of companies that do these tests at home. So you don't even
Yes.
need to see a doctor. Just do an at-home test. It costs $150. Buy it online, see what your results are. If there's anything wrong with it, come see a fertility specialist.
I wish that we were just making this part of standard physicals. Like why at the like at any I mean I say this for women all the time, like why aren't we measuring AMH at age 20, 24, 28, right? Just so that we can see what's happening. It seems so obvious that men should just know to do the semen analysis so that they know going in what to expect. I don't know why.
Exactly right.
How do things like that become standardized?
One easy way is to have insurance cover it. The big thing
Mm,
is, insurance does not even cover, even for couples who have infertility,
right.
that it doesn't cover semen analysis. But that, and then obviously educating patients on that,
Yeah.
letting them know.
That's
And that's the beauty of social media. It really is this.
yeah.
We're letting people know about the advantages of early preventative, or at least getting to your doctor earlier to address these issues.
Crazy. Okay, so let's go to number three, which is genetics.
Genetic issues.
Genetic issues. Break some of these down for us. What would that present like?
Yeah, so there's probably hundreds of genes that control male infertility. In the year 2025, we only know of four of those genes, and we only have, tests to gauge those four. One of them is called karyotype, where we know men have an X and Y chromosome. Sometimes men are born with abnormal X and Y chromosomes, or they have an additional Y chromosome, what have you. That's one reason, and then the other one is on that Y chromosome there's various microdeletions, and we know of three different microdeletions: A, B, and C. A and B, if you have those deletions, you're sterile. You'll never be able to produce sperm. If you have C, you're producing severely, severely low sperm counts. However, that being said, there's other hundreds of genes that control it, and we don't know of all of those. But one thing I'll tell you, if a guy comes in with what we call azoospermia, meaning no sperm in his ejaculate, we try to do everything we can to optimize him. Like we talked about, lifestyle factors, hormone factors, address any varicoceles, tell them not to really, no saunas, steam rooms, jacuzzis, nothing that increases testicular temperatures, really optimize them. And then they only have one option at that point for fertility, which is, we call it a testicular sperm extraction, where we go in the testicle and we have to look for sperm, individual sperm.
And that, I imagine, like everything in this world, is not even 100% guarantee. You just do your best.
Exactly right. Precisely. Yeah.
And I assume if you're doing it that way, you then go for IVF or you go for IUI or it depends.
When you're going directly into the sperm, your only option is IVF because these are
Okay.
immature sperm.
Oh, right.
IUI, IUI is if it's ejaculated, but when
Right.
you're going into directly into the testicle, it's immature sperm. So yeah, your partner, she's committing herself to IVF, which is she has to get an egg retrieval on the same day or the day before of her egg retrieval. We go in there and we do the sperm retrieval. And one thing I'll say, it's the hardest thing, but we have to tell it, listen, the chances of this are anywhere from 20 to 50% of finding sperm. One thing to consider is having donor sperm on backup, which
Yeah.
that's a tough one for some couples.
Yes. Yes.
Yeah,
And can you freeze any sperm that have been extracted that way, or does it diminish the quality too significantly?
definitely. We could definitely freeze. We know that the one thing about sperm, because they're weak, every time you thaw, every freeze thaw cycle, you're losing about 50% of them. But again, I mean, the hope is when we go in there and we do a sperm extraction, we're finding tens of thousands of sperm.
Mm, mm. So. Wow, I had like this is so fascinating to me because I never deep dive into this. I think we were at an event together where somebody said that in the dating world, people are starting to talk about as they're courting whether they have frozen eggs and frozen sperm. And I was like,
Yeah.
that's amazing. Like it's one thing to talk frozen eggs, but I would be so impressed with a man who was like, I'm going to freeze my sperm because you just never know what's going to happen. Are you seeing that at all?
Yeah, more so the frozen eggs.
Yeah.
Yeah, not so much the frozen sperm.
Yeah. But
Um,
I do feel like and I want to talk about a couple myths. Like one of them is like you can procreate as a man at any age and your sperm doesn't really age, but that's not true, right?
well, you could have success, right? You could have good, but the one thing that people forget about men. I mean, we know Al Pacino, Robert De Niro recently
Yeah.
had children in their 70s and 80s, but I'm sure there was IVF. There was a lot of steps that they took in order to get to that point. But we do know as men start to age, that's when you start to get there's certain things that are associated with unhealthy sperm or advanced paternal age. One of them is Asperger's, the autism spectrum, those types of things, and so other genetic conditions. So it's not just, a man will obviously there's evolutionary checkpoints in place that could protect against this, but your chances of having genetic issues increase as the paternal age increases as well.
Okay. And as of now, as far as I know, there is no genetic test, or maybe there are markers for things like Asperger's syndrome, autism spectrum yet.
Not yet, not that I'm aware of either.
Okay.
No.
Okay. I was
Yeah.
just curious. I don't know. I think again, I just wish egg freezing and sperm freezing were part of the standardized, protocol for life so that you just have, God forbid, you need to, because like sometimes you have people who are given a cancer diagnosis and they have to rush to preserve any sort of fertility. And like if we just did this standard, nobody would have to stress about it, you know?
Yeah. See, sperm freezing is actually very easy. Actually, was looking this up today. It's $140 a year, right? To sperm. Yeah. I get that's it. That's
That's
all it is.
crazy. That's like
Right.
a sixth to an eighth of what it costs to store eggs for a year.
There you go. Exactly. And the
Yeah.
cost of the injections for egg freezing are even more. Like
Yeah.
that's the problem with egg freezing. I get it because it's expensive.
Yeah.
Sperm freezing, there's no excuse.
Yeah. Just do it.
Yeah.
Are there one other myth I wanted to talk about with you is I feel like in terms of the prostate cancer world, if you ejaculate a certain number of times per month, you'll not get prostate cancer. Is that a real thing?
Yeah, so there's this study that it probably came out, I think it was like 10 years ago, where it said if you ejaculate at least 21 times a month, your chances of prostate cancer significantly decrease. I mean, there's so
It's like
many variables.
a bunch of married men put that study together. I'm sure of it.
Yeah, yeah. But I mean, there's no validity to it. But
Okay.
look, the healthier you are from a sexual standpoint, this is the one thing I'll say. If you're healthier from a sexual standpoint, it generally means you're healthier from an overall health standpoint, like cardiac standpoint, overall health. So there is something to be said for engaging in more sexual activity generally means you're a healthier person. That's
Okay.
the idea.
Um, Shoot, the question just went out of my head. Frequent ejaculation, health. Damn it. I'm gonna have to edit this now. It was good too. All right, we'll skip it and move back on. Are there other myths that you feel like you hear that are just a common myth that we can bust right now? Oh, I know what it
Yeah,
was. I know what I was gonna ask. along the myth line. Do you believe that acupuncture can help with sperm?
I do. I
Okay.
actually do. Yeah, and the reason is the really and I've seen the impact on my patients for sure. Acupuncture could really like Eastern medicine is a real thing, right?
Hmm.
Obviously, Western medicine is wonderful, and there's a the synergy between the two that I think a lot of us forget. But Eastern medicine with acupuncture, one of the things I've noticed is when guys have anxiety or even anxiety associated with the fertility journey, or even if they're high stress before all of this, acupuncture helps calm them down in many ways. And we know that by decreasing your stress hormone levels, so let me take a quick step back here. The same stress, the same precursor hormone that goes for cortisol, which is the stress hormone, that is also used to make testosterone. So if you're more stressed out, you're producing more cortisol. Therefore, you have less going to the testosterone pathway. So by decreasing your stress levels, your anxiety levels, we know that it could improve your hormone levels, and by improving your hormone levels, it can only help your fertility.
Have you ever seen it work for something like azoospermia? Has it all of a sudden created actual sperm in the ejaculate?
So it hasn't created it in the ejaculate, right? But has it improved our chances of finding sperm when we do the testicular sperm extraction? There's no way of truly knowing, right? Right. I mean, because it's not like I did
Right,
the biopsy before. But
right.
one thing I'll tell them, if you want to exhaust every single option, that's one thing to consider as
Do
well.
it. Do it.
Yeah.
One other question
It can
about,
only help. It can only
sorry, yeah.
help.
Yeah. And the stress relief factor is so important. And if it's
Absolutely.
that alone, it's worth it.
Exactly.
When you freeze sperm you've extracted via Tessie, how do you freeze that if you're literally just pulling the sperm by sperm? Like, I imagine when you freeze sperm, it's the entire ejaculate. So there's like a little fluid in there. When you're pulling literally sperm by sperm, how do you freeze it?
So we're not pulling sperm by sperm. We're pulling
Okay.
sperm with associated tissue.
Okay.
So then what we have to do is we have to cut that tissue up in order to release the sperm. And then once we find that sperm, we're able to separate that for the most part, separate that sperm from the rest of the tissue, put it in a like cryopreservative, and that solution freezes in a nice gradual way in order to preserve that sperm quality. Yeah.
Crazy. Okay, you were about to say another myth that you feel like you hear a lot.
I guess one myth, and this is something the OBGYNs and REIs could attest to too, is there's a lot of guys who are like, well, listen, I want a boy. Should I do it in this position?
Yeah.
Should I engage it? And there's no validity to any of that
That's a
either.
good one. Yeah.
Yeah, but guys are really like, yeah, I've had that for whatever reason recently. Actually, a lot of guys are asking, what position? If I want a boy for my first child, what position should I do? Like any position, and then
Yeah. Well, I
whatever
think,
works for you.
don't they say, I don't know if this is myth or true, but sperm that moves faster is generally becomes a boy, and sperm that moves slower generally becomes a girl. So sometimes the woman will wait to ovulate towards the end of her. I don't know. Timing was not my issue or my thing, but is that true?
It's not. It's
Okay.
not. I mean, it's a flip of a coin, right?
Yeah.
It's truly the flip of a coin.
Okay.
And having whatever you had as your first child has zero impact on your second,
Yeah.
right? Each time it's literally 50-50.
Yeah. Okay. That's really good to know. Soundbite. Like, I'm gonna just play that over and over for people. Are you happy you went into the field of urology?
Absolutely.
You
Yeah.
clearly love what you do. I mean,
And
duh.
I'm yeah, and I'm very lucky. I really am very lucky, to be in this practice where I am, to do what I do. Don't get me wrong, it has its frustrations, but it's wonderful. It
Yeah.
really is.
Yeah.
Yeah.
Um, any other, I mean, we went down the deep dive of infertility. What are the other main surgeries you're doing, do you think?
Well, I do as much as I do for reproductive health, I do a lot of sexual health. So essentially guys who can't have babies and guys who can't have erections. So
Hmm.
I do a pretty unique surgery called the inflatable penile implant.
Whoa. Tell
Yeah,
us
so
all about
guys
it.
Yeah, so guys who are they've tried all the Viagra's and the Cialises, whether they're unhealthy or just old in age, we're all going to get erectile dysfunction. But at some point, they're at the end of the road and they still want to have good erections. There's a surgery where we implant, think of it like two balloons, two cylinders, saline-filled cylinders in the penis. There's a pump that's in between the testicles in the scrotum. Everything's contained under the body. And then there's a reservoir, a fluid-filled reservoir that sits in the abdomen. So every time they want to have an erection, they pump they squeeze the pump and the fluid goes from the
Oh my
reservoir to
God.
the penis, giving them an erection.
Oh my gosh. Let me
Yeah.
guess, that is covered by insurance. No.
Medicare fully covers that.
Stop. Are you
I
kidding me?
Medicare fully covers
Oh
that.
my
Yeah.
God, this
Yeah.
country. Okay. I love to ask people if anything comes to mind. Is there any piece of advice maybe your dad gave you, a grandparent, something that you just think about maybe more often than other phrases, sayings, cliches, anything you think about in your day-to-day life?
Um, I'll tell you something that I've been trying to be mindful of recently
Yeah.
is I read that book Atomic Habits,
Yeah.
and just try to be a little bit better each and every day. But the key thing is just a little bit better. You know, I think
Hmm.
at least for myself, throughout the whole journey of this academic journey, it's big strides. Whether it's every week, every month, you want to take big strides. But I think at this point in my career, those big strides probably it's hard to make those big strides. So
Yeah.
making these marginal improvements on a daily basis, ultimately over the course of months to years, will lead to better outcomes.
I love that one. It's a really good one. I feel like at some point we're going to need to do a round two because I think I'm going to have a million questions after this episode, even if not just from
I'd love
me.
to.
Yeah.
I'd
I
love
just,
to. I'd
it's
love to. This
so
was fun.
fascinating. It's just super fun. And I
Yeah.
really look forward to seeing you again. We will, of course, link out to all of your Instagrams. And if people need you, if somebody needed like a virtual consult because they're not in California, but they don't have a trusted urologist for reproduction, can you do that?
Yeah,
Okay.
absolutely.
Okay. Good to know.
Absolutely.
Good to
Yeah.
know. Well, thank you for being here, Dr. Human.
Hey, thank you for having me. This was great.
Bye.